When it comes to treating gynecomastia, the old way usually involved a scalpel and, some pretty significant scars. But a newer, less invasive method is really challenging the status quo. So today, we're going to dive deep and look at the head-to-head data from a recent study, and we'll even explore what happens when you try to avoid surgery altogether.
So, here's what we've got on tap. First, we'll get on the same page about what this condition actually is. Then, we're going to pit the traditional gold standard surgery against its modern rival, really digging into the hard data to see which one comes out on top. We'll also take a look at whether injections are a real alternative, before wrapping it all up with how you might think about choosing the right path for you.
Okay, let's start with the basics. It's really easy to dismiss this as just a cosmetic issue, but for the people who actually experience it, the impact goes so much deeper than what you see in the mirror.
So what are we actually talking about here? Well, gynecomastia is a common endocrine disorder. You'll hear this medical term, hyperplasia, which is really just a fancy way of saying an enlargement of male breast tissue. And this is a super important point. We're not just talking about fat from gaining weight. This is an actual increase in glandular tissue, and it's often driven by a shift in hormone.
And the real-world impact of that? It can be absolutely massive. The researchers in the study we're looking at put it perfectly. They said the condition can cause really profound psychological distress and social embarrassment that goes way, way beyond just the physical symptoms.
All right, so how has this traditionally been treated? Well, for decades, there's been one very clear gold standard surgical approach.
It's called open excision surgery, and honestly, the idea is pretty straightforward. You make a larger incision for direct access to just remove all that excess tissue. And look, it's incredibly effective, and the chance of it coming back is really, really low. But there's a big trade-off, a longer, tougher recovery, and maybe most importantly, more noticeable scar. But technology never just sits still, right? A modern challenger has officially entered the ring, and it aims to deliver the same great results, but with a much, much lighter touch.
And this is endoscopic liposuction. Instead of one big cut, surgeons make these tiny little incisions and insert an endoscope, which is basically a tiny camera along with some specialized liposuction tools. This lets them see exactly what they're doing and very precisely remove the tissue with minimal damage to everything around it. The goal is super clear: get the job done with less pain, a faster recovery, and way less noticeable scarring.
So, before we jump into the data, here's the tale of the tape. In one corner, you've got the traditional method. A bigger incision, direct removal. It's effective, but scars are part of the deal. And in the other corner, you have the modern approach. Tiny incisions, camera-guided, with a real focus on the aesthetics. Now, let's see how they actually perform when they go head-to-head.
Okay, this is where it gets really interesting. Let's get into the evidence. Our main source is a big comparative study that followed 140 patients. They randomly put half in the traditional surgery group and the other half in the endoscopic group, and they tracked everything: complications, pain, even how happy patients were a year later. And well, the very first thing that just jumps off the page is the dramatic difference in safety. Just look at these complication rates. With the traditional surgery, nearly 29 out of every 100 patients had some kind of issue, like an infection or slow healing. With the endoscopic method, that number plummets to less than 3 out of 100. That is a huge, huge advantage right out of the gate.
So, what about the patient experience? How much does it hurt? The study used a standard 1 to 10 pain score. A week after surgery, the endoscopic group already reported a lot less pain. But check out the 3-week mark. The traditional group was still at a 4.5, while the endoscopic group was all the way down to a 1.5. That points to a much, much faster and more comfortable recovery.
But here's the million-dollar question. Does a smoother recovery actually lead to happier patients in the long run? Well, the study followed up a full year later, and the answer was a resounding yes. On a 5-point satisfaction scale, the endoscopic group scored a 4.23, way higher than the traditional group's 3.06. And why? It's pretty simple. Patients were just happier with how their chest looked and how minimal the scarring was.
Okay, now this is the part of the study that really blew me away. You'd think that traditional, more invasive surgery would be better at preventing the tissue from coming back, right? Well, you'd be wrong. A full year later, the recurrence rates were basically identical for both groups. This means the modern, less invasive method was just as effective in the long run. That is a total game changer. So, the evidence for the endoscopic surgery is pretty compelling. But it makes you wonder, what if you want to avoid a scalpel altogether? And that brings us to the wild world of non-surgical cosmetic treatments. So, can you really get the results you want with just a needle?
Let's take a look at what people are saying about one of the most popular options out there, injection lipolysis.
So, how does this stuff even work? Well, this procedure, you might know it by brand names like Kybella, uses something called deochalic acid. It's actually an acid our own bodies produce to help break down the fat we eat. The idea is to inject it right into a specific area where it literally destroys the fat cells, for good. Your body then just naturally clears them away over time.
Now, unlike that big clinical study we just looked at, the evidence here is, well, it's anecdotal, and it's all over the map. Take this experience someone shared on Reddit. They described spending $1,700 enduring this intense bullfrog swelling, all for nothing, no noticeable change. And this is a really common theme in the negative reviews. It's expensive, there's a lot of downtime from swelling, and the results can be super disappointing.
But then, just when you think you have it figured out, you see a completely different story, like this one. Another user says it made a huge difference with minimal swelling after just 2 treatments. And this crazy contrast really highlights the biggest challenge with these injections. The results seem to be wildly inconsistent and unpredictable. It probably depends on a ton of factors, like the person's specific body and how it responds.
Okay, we've seen the old standard, we've seen the modern challenger, and we've seen the no surgery wild card. So let's pull all this together and really look at the final trade-offs.
So let's break it down one last time. Traditional open excision, it offers that promise of the most thorough removal, but you have to accept that significant scarring and a tougher recovery are very likely. Then there's endoscopic liposuction. Based on the data, it strikes this fantastic balance. It's just as effective in the long run, but with way fewer complications, less pain, and much, much higher patient satisfaction. And finally, you've got injections. They're non-invasive, no scars, but you're really rolling the dice on whether they'll work, and it could get pretty expensive if you need multiple rounds.
And honestly, this is probably the most important takeaway from all of this. There is no single best answer that fits everyone. The right choice completely depends on your specific anatomy, how severe the condition is, your personal feelings about scarring, and what your goals are. And that's exactly why having a really detailed conversation with a qualified doctor is absolutely essential before you even think about making a decision. And that really leaves us with one big final thought, doesn't it? This head-to-head comparison shows us a really clear trend in medicine. It's not just about whether a procedure works anymore. It's about the patient's entire experience, from the pain they feel to the scar they see in the mirror every day. And as patient satisfaction and aesthetics become more and more central to what we call a successful outcome, it really makes you wonder, how is this shift going to continue to drive innovation across every single field of medicine?